Today we're going to change an ostomy pouch on a stoma, and we'll get started here. Read your client's care plan. Make sure you have the right client before you enter the room. Make sure that you're following the standards and facilities procedures, and make sure that it's in with your scope of practice and that you have permission to perform the procedure from the client, and that it's within the facility standards and procedures. So we're going to clean the sanitize our hands before we enter the room. We have looked at the client's care plan. We have identified the client's name. We know what system the client needs to have changed. We have looked at any other restrictions or concerns or conditions on the client's care plan. The client's name is Mr. Jones. I'm going to do my knock, 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 knock. My name is Lori. I'm your healthcare aide today, Mr. Jones. May I see your ID, please? You are Mr. Jones? Yes, I am Mr. Jones. Great. You identified your client. You explained to him what procedure you're going to do. You've come to change his stoma, clean and change his stoma today. And he says it's okay, it's good to go. It's a good time for him. You try to change it in the morning. The morning is usually when the stoma is less active, or the client themselves may know when the stoma is less active, or you may be changing the system because the bag is leaking. You would change the bag when it's 1/3 full. And so those are the reasons why you may be changing the system. You've gone through your safety of the bed. You've checked your brakes. You've brought your supplies. You've brought the pouch system on the person's care plan. You've brought your adhesive remover. You've brought deodorizer for the bag. You have hand sanitizations. You have a pair of scissors. You have a pen. You have a chart, a measuring chart for the stoma. You have gauze, or you can clean the stoma with soft gauzes, or a soft washcloth. You have your barrier cream. You have your new system. You have your scissors. You may have some paper towels or waterproof pad, or just a towel to lay around the stoma. The client, don't forget to give the client privacy. Check the brakes on the bed. Raise the level of the bed to your body mechanics, your waist. Make sure the bed rails are up when you're raising the bed. Have the client in a comfortable position if they're able to. So they're in sort of a comfort zone while you're changing the stoma. Actually, I have to put that system back on because I don't have another one. So we'll pretend that we'll put that back on. You've got all your supplies. You brought your gloves. You brought your disposable waste baskets. You brought the water with a temperature of 40.5 to 42.7. You've identified the temperature of the water with. Where are my gloves? You've identified the temperature with a thermometer. You've checked the temperature, and the client has also agreed that the temperature of the water is great for him. Check your gloves. Make sure you have an extra basin for the system to be put in and removed or disposed of or emptied properly, and it masks the odors when you remove it. Try not to show that the odors are disgusting for the client, so the client doesn't feel any embarrassment. Make sure you've given that client privacy. So right now our brakes on the bed have been checked. The brakes are all fine. The bed rails are up. I'm going to let the bed rail down on the side in which I'm working on. I've cleaned and sanitized my hands. I have checked my equipment. I have checked the bag system that I have. It's the proper system. And I'm going to use a waterproof pad, or you could use a towel. I'll use a towel. Place a towel around the area. And I'll have to turn this so you can see it. Here. You may have some extra. Bring some paper towels. Make sure you put your equipment on a clean surface. Place a towel under it. Wipe, sanitize the top of the table. Place a paper towel under your equipment or a towel, and then place your supplies on top. You've changed your gloves. You've examined the patient. You'd ask the patient questions if he's in pain or anything else, how he's feeling that day. So when we remove the system, we hold the skin tight with slight pressure. Not hold it, put pressure on the skin. Start from the top and remove the system downward. Possibly trying to mask the odors that would come from it. If there's any adhesion in this area, you can remove it with the adhesive remover. Cover the bag. Place the system in your pan or bowl. Cover it with a paper towel. It'll help mask the odors. You could also bring room deodorizer for the room while you're doing this, or maybe even turn the bathroom fan on in the washroom that's there, that would help with the odors in the room. Place the towel around in your area just in case you have leakage from the stoma. There's 3 positions a stoma is actually made. One is on the left side, which is the colostomy, which comes from the colon, the intestine, the large intestine, called the colon, and it would be on most likely on the left side. The colostomy is on the right side. It comes from the small intestine, and the urostomy is also on the right side because it also has a shorter tube, so it may be on the left side, but 2 of them are on the right, and the one would be on the left side, most likely. So now we've removed the system. We have placed it in. We have placed the pouch in a pan. We have covered it to mask the odors, and we might want to change our gloves, putting them in the proper disposable waste basket. Clean and sanitize your hands. We're going to take a soft cloth with just water. We don't want to use any soaps or of such, or any alcohol-based items. They could possibly dry and irritate the skin. We would not want the soaps to interfere with the adhesive from the system. You can take a soft cloth. Once you clean this area, you can use a soft cloth, or you can use gauze. I'm going to switch this to my other hand because it's my stronger hand. So you can clean the area, wipe any excess off. Don't be afraid to pat it like this. It'll be moist and meaty and red or pink looking, healthy. The tissue, it does not have any feeling, really. It's tissue taken. It has no sensitive nerves. So you clean the excess off, pat it dry. I'm going to use just a smaller cloth to pat it dry. Just pat gently. Don't be afraid to pat the top of it, but it's just as if you're cleaning the meatus on a penis. Let it air dry. Check the tissue around it for any cracks or discoloration or any other skin abrasions. Look at the stoma itself to make sure that it's pink and healthy and moist. So we try and dry this area out, possibly even air dry it. Once you've washed it with just water, change your gloves. Dispose of your gloves in the proper waste. Dispose of them. Clean and sanitize your hands. Make sure you have lots of gloves just in case you get some fluids on them. Check your equipment to make sure that it's intact. Check your system, that you have in a minute. I'll show you. Once this area is thoroughly dry and it looks all good, if there's anything concerning, such as the discoloration in the skin, or you know that there has been some leakage in the skin, which is not good. The system, this is a two-part system. It actually, when you open it up, this is called the wafer, and the ring is called the flange. It actually just snaps into place, and the back of the system is peeled off, so it adheres to the skin. Now, the chart, which everyone talks about, is that sometimes these systems don't come with how to measure or markings to measure the size of the sternum. So we have a chart that we place around the sternum, which is now clean, and we measure the correct size with the chart. We try to get a little bit of give, about 1/8 of an inch around the sternum, and that would be a perfect fit. And my choice is 38 millimeters, which is this one. I have already pre-cut my circle. So when we have to measure and we have no measurement on the back of the waver, we would take this, place it here, and draw with a pen the size we needed. We try to cut this circle as smooth as possible, because the jaggedness or the way can also injure the sternum. Just think of this thing sitting on somebody and then moving around. So you try to make it as smooth as possible. So this is your measuring agent. You press it down on the skin to measure, which is good. So I pre-cut mine. And when you cut, some of the systems have a bag in here. You have to be careful that you don't cut the bag. And you don't want to be touching inside of something, right? You don't want to be touching everything so much, because I mean that's not good. So what happens is, when you're cutting this circle, try to always undercut the circle first to make sure that you really got a good fit, because a good fit is not when it's too big. You can always fix small, but not too big. When you cut a circle, if you cut little indenting cuts into the circle, it's easier to cut the circle. So you could do 1, 2, 3, 4 slight cuts to the size you need, or you could even do more into that circle circumference, and it would be much more cleaner cut. So mine was 38 millimeters, sorry. And So you measured your system. You've used any adhesive remover to remove it. You've cleaned your stoma. You've have your barrier cream. Make sure that you check the expiry dates, and that you check with make sure it's the right cream for the right client, and make sure that both your adhesive and your barrier cream. Now, the barrier cream would go on the back. Some people like to put it around the stoma, but you'd put it a little bit around the back. Remove the backing. It's adhesive. It sticks to the skin, so once this is removed and pressed down for a couple minutes or whatever the procedure to with the system instructions are, you would then remove this, dispose it in the waste, proper waste disposal, and follow with the procedure to seal this. This one is, once you remove the backing, you hold it, press gently down, make sure the system is all with no wrinkles, and slightly pressing down around it to help create a really good seal. You would apply the slight hand, which is also not only heat, but a little bit of pressure for whatever instructions on the manufacturer's system requires. This system snaps into place. These two little are, you can hang a belt to hold your bag. You can actually hear the system snap. You press them slightly together to hear that snap. And what I've seen, which I think makes more sense, is that once you peel the back of this off, and your barrier cream is on the back, and make sure you follow the instructions for your barrier cream. You would place this around the stoma and press it down. Now, the client could help you if they're able, or maybe this is the first, well, you wouldn't be doing it on a first-time client anyways, but he could help you. And so this slight pressure, once it's in place, you just hold it for wherever the instructions on the system is. And you can test it by just seeing how tight it is. Once it's on, you can actually test it to see if it's going to, if it actually has adhesed itself to the skin. Now, this system comes with a clip. My clip does not work anymore. It doesn't even snap, but it snaps into place. The curvature of the clip is to the client's leg, or the comfort of the client's leg, so you can't see it. So you actually have to hear this clip, or hear this snap. This one doesn't snap anymore because I've done it. I've been using it and stuff. So you have your bag, your pouch is covering your soda. You have your, and also check the expiry date on anything that you use on a client. And if it's actually for the client, you would put a couple drops in the bottom of the bag, just a couple. Make sure that the top is clean. You could wipe it with a gauze, or if you had used the barrier cream, you would first clean with maybe a tissue or a piece of paper towel, clean it off a little bit, expel some of it first, and then use it directly from the tube. So go in the garbage. So we put our deodorizer in the bag. This also comes in powder or liquid. I lost my clip. Here we go. It doesn't even snap, so it's not much fun. You placed the clip over the pouch, and this won't even stay anymore, and snap it into place, and you can actually hear the snap. That snapped. Once you have that into place, make sure you check this system itself, the pouch itself, to see you could therefore have completed your task. But I want to open this up and show you what you could actually can do. And it turned that this way. Now what happens is that if we wanted to empty a bag, if we took this bag off or it was attached to a client, the client could, I have to put this back on here. The client, if this bag needed to be drained, you could actually pull this plastic over. It should be enough, it should be at least a couple inches that you would be able to fold this over and put your fingers behind it, which would almost form a tunnel or a funnel like cupping. It's actually called cupping. And when you opened up the clip to drain the bag, your fingers would be in this position. This is so hard because this is so small. They would be cupped behind, they would be behind the bag because you've turned the bag the other way, and you could therefore empty the system into the toilet, or if you reuse the bag. And you could clean this part of the plastic off with tissue or even wipe it clean. So when you went to close your bag up again, that would be all clean. It would not be contaminated or touched with anything, and you could just re-snap your bag. So we've put the deodorizer in the bag itself, and we've closed the bag, we've checked the system, we've cleaned the stoma. The custodian is never cleaned with any soap, unless it's in the care plan, it's cleaned with just warm water, soft gauze. Make sure it's all patted dry. Clean your supplies up. Dispose of your pan with your pouch in it in the appropriate place. When you change the bag, you do the cocoa system of color, odor, consistency, and amount. So you check to make sure it looks healthy, and anything else you need to record and report on your care plan for that client's care plan may be recorded on their flow sheet. You would then make sure the client is comfortable. Make sure that you don't make him feel uncomfortable with the odors. So we have finished up changing our ostomy bag. We've checked the system. We've cleaned up our supplies. We have made sure the client is comfortable. If he has any questions or other concerns, or any other anything he may be concerned about, report to the nurse the client's concerns. So I clean and sanitize my hands. I will position the client back to the proper standards and procedures in his care plan with his bed. Raise the bed rail to lower the bed, check the brakes on the bed, position the client, make sure his call bell is in his proper, the client's easy reach. Cleaned up your supplies, report and recorded your procedure. If you had to report any other concerns to the RH or the nurse, make sure you report the concerns to her. Wish the client a great day. Dispose of your pouch in the proper setting. Make sure you do the proper disposal and of the unit and placing items back to where they belong. Make sure the client's care items are put away in the proper place. Make sure you've cleaned your supplies up. Wish the client a great day. Thank you.